Hi, Dr. Zoe from Calgary, Canada. Just I came into work early today and I wanted to talk about the topic for my followers. I've seen in the last 2 days, I've seen about four patients present with this, and I've made a video on this topic before, but I think it's important now because a lot of people don't know what's wrong going on with them. The topic today is menopause. A lot of our ladies, African ladies, the Caucasians, are going through things. And most times they don't understand what to do. They don't seek for help and they will be there in agony. It's actually a lot of agony, believe it or not. Now, to people ask me, what is menopause? Menopause is a natural process where women will start to, their ovaries will stop to produce eggs. It's as simple as that. And it's between around 48, 52, with average of about 50. I mean, Africans can be a bit younger, but average is around 50, 50 years of age. And you start noticing the periods become scanty, like they don't come every month the way they used to. It can be every 3 months, and sometimes it's very light. That's what we call perimenopausal period. This period, it could last 1 or 2 years. But the actual, what we call postmenopause, when you're heated, is when you haven't seen your period for about 1 year. Remember when some ladies that use contraception, like Marina, US, you might not see your period at all. So that's different, okay? But again, that becomes complex with women that use this contraception because they won't know. But we know because, when I tell you about the symptoms, you'll appreciate what I'm talking about. There are mood changes, there are a lot of mental health issues that go through your body, okay? Now, if this happens, like if you stop seeing your period when you're less than 45, then it's much early. That's what we call early menopause. There's a lot of things that could cause it to. There are secondary causes. Remember when people have surgery for cancer and stuff, and they take away their ovaries, so that happens. So, what are the symptoms? The main symptom is due to the estrogen drop. The ovaries are not producing the estrogen, so the estrogen drop will give you a lot of major symptoms. The vasomotor symptoms, as we call it, the hot flushes or moditina, maybe small thing, and it's very common, like 75% of the cases. Your body will just turn fiery red, face, you'll be irritable, sweaty, palpitations, your heart will be thumping up. It's not fun, trust me. I see women in my clinic going through it right in front of me. They're helpless, they're frustrated. And for a lot of our women back home in Africa, they don't know what's happening. You need to hear this today, okay? You see, at night you wake up and the whole bedsheet is drenched. It's not your village people, my sister. It's just menopause. We couldn't call it night sweats. It's bad because I've seen it. Okay, you'll be irritable. You don't even want anything to do with your husband in terms of sex. Your mood is low. You're depressed. You're anxious. And these things can last for several years. Some people are lucky and their menopausal symptoms will last for just 1 year or so, but some other people are unlucky and they last for a very long time. Gives you changes in your body. Your skin will be dry. Your vagina will be dry, so sex will not be fun. And it leads to fragile bone, osteoporosis, as we say, and it even increases your cardiovascular risk of stroke and heart attack, and even dementia. Menopause is a big deal, trust me. So, in terms of treatment, the one I consider the worst, see that hot flushes, the night sweat, and the mood problem. The mood is the main one because they don't want to come out and say that to you. The Caucasians are more open, but the Africans are not. So they won't come out. You're going to notice that there are mood changes in this person, okay? So, in terms of treatment, we advise them to stop smoking. If you smoke, lose weight, cut down on alcohol and coffee, and exercise. We say that a lot. But for severe symptoms, frankly, you're looking at hormone replacement therapy, which works in majority of the cases. I think it's available in Nigeria too. You can, like, if the main thing is the vaginal thing, that people will give Primarine vaginal tablets and vaginal cream to make it moist, and you still enjoy your sexual intercourse. And the HRT helps with the hot flushes and all that too. Now, Evidence says that antidepressant, that the regular SSRI doesn't help, but I've tried it before on patients and it worked well. I've tried a citalopram on patients that have menopause. It didn't take care of it. It didn't remove it because they didn't want to have. They didn't want to go to HRT because of the, everybody's afraid of long-term use and cancer. So we tried her on SSRI, a citalopram to be present, and she did very well. So I say, just to bring this update to my followers, it cannot be, this is a 6 minutes video, it cannot be comprehensive, but this is just to bring awareness that if you're around 50 there as a lady, all those things going through your body is not your village people, it's what we call menopause, and it has treatment. Seek help from your doctor. I won't say it's easily treatable, but it's definitely treatable. I've treated them. Take care and have a fantastic weekend. Dr. Zoe again.